We're going to look at these two pictures. The control center is situated in the brainstem. This is the brainstem right there. Can you see that? And this is your spinal cord. Now, this is the midbrain. This is the brainstem. When this guy, the brainstem, is overactive or overfiring due to chemical imbalance in all the brain, this guy here is out of control. Out of control. In other words, it starts firing because the midbrain tells the lower brainstem, hey, calm down, guy. You're under my control. I am the CEO. Okay? So if the lower brainstem is beyond control, you start being hypersensitive. Muscles, ligaments, joints, organs, skin irritability, everything would be on fire because they are not controlled. Your peripheral nerves, your pain fibers, they're called the C fibers, they start overfiring and you become hypersensitive to touch. If anyone touches you, you go into 3-4 days of increased symptoms. Okay, because this guy is not being inhibited or calmed down. Okay? Now, how many of you are familiar with this picture? Raise hands. Good. Raise hands. Okay, only a couple of people. Okay. Now, what's this? This is our body representation. It's called the homunculus distribution. Fancy word, okay? What it means is that this is our body representation in our brain, ladies and gentlemen. Your body lives in your brain. The world needs to understand this. You cannot disregard the brain. My elbow hurts, doc. Did you break it? No. Did you fall? No. Did your wife hit you with a pan on it? No. Okay, whatever it is, my elbow hurts. Okay, watch. Very, very important slide. This is a cross-section of the brain. You know what a cross-section is? They took the brain and they sliced a piece of it. And they studied this for decades. This is not new. They've been studying this for decades. Look, for example, let's take your elbow. Speaking of elbow, huh? This is where the elbow lives. In the brain. So in other words, your brain tells your elbow to move. Elbow has no function on its own. Does that make sense to you? Okay. Now, you take, for example, you know, people come to me and they tell me my tongue is vibrating or twitching. Or look where the tongue lives. Can you see that? Can you all see it? Who cannot see it? In the brain. You can see it here. Watch. Tongue, lips, nose, etc., etc. So we are what we call a topographical map in our brain. Whatever happens in your hard drive, it's going to affect every single cell in your body, every single organ. Beautiful information, isn't it? Okay. Now,
is that right brain, left brain?
No. A great question. This is not right brain. This is one area. Great question. Okay. One area is for the motor activity, which means one area tells your limbs to move. And one area you feel in it, okay? All right, we're gonna proceed here. So what happens if you don't do anything about the fibromyalgia? The longer you leave fibromyalgia, the more your brain dies. We saw this earlier. 9.5 times the loss of normal aging. It increases long-term widespread pain, stiffness, and rheumatic syndromes. Arthritis, osteoarthritis, all this stuff. It increases systemic inflammation. Why? Because your body is on fire. You decrease in energy level and your ability to carry on your daily activities. No one would like to do that. Increase in anxiety, more difficulty to sleep. Okay, a lot of people come to me and say, I can't sleep, doctor. I have insomnia, okay? More and more crippling symptoms. Very debilitating disease. Okay, very key points here, physiological facts. Brain electricity, ladies and gentlemen, is the marker of life. If your brain is not firing properly, there is no proper life. Very, very deep understanding. The presence of a charge distinguishes between life and death. Now, that's why if you see a dead body, no life. There's no charge. He's not firing. He's gone. That's it. Life has left. Okay? But we, as if we are living, our brain is firing. But it has to fire the right way so that it keeps us coordinated. The brain can lose the speed of firing. Like, for example, you see sometimes that you want to think of something, you can't think of it. It can misfire distorted signals, wrong pathways, okay? And have slower conductivity to all organs and systems. For example, if 1 and 1 is 2, right? You all agree, right? Okay? But with someone with fibromyalgia, 1 and 1 is 10. Because they are hypersensitive. They can't assess, they don't know the magnitude of the signal. Your brain perceives pain more than it should and is not able to regulate. For some fibromyalgia sufferers, it can be so bad that 1 plus 0 equals 10. Because it takes a little stimulation to make them feel extreme pain. So ladies and gentlemen, the purpose of this discussion is to allow you to make educated decisions beyond what you've been told or diagnosed with. It's not what doctors tell you. Or, okay, I have a diagnosis, I have fibromyalgia, look at me. No, that's not what it is. It's beyond that, okay? This is knowledge that can change your life forever. Very, very profound. Brain mapping is a science which explains the cause of a human system's failure. Contemporary research in functional neurology, this is what we practice, gives us an insight on how the body breaks down into unrelenting chronic pain conditions and dysfunctions. It's an insight, it's a window, all right, for us to be able to assess what's going on. It's the missing dimension in healthcare. Through the science of functional neurology, it is now possible to assess the physiological integrity of the nervous system and correct dysfunctions that lead to progressive disease. It is a neuroscience based on the physiology of function. You need to understand this word, very, very important. Not just symptom management. Take this pill. Okay, I'm fine. Next day, another volcano, okay? All right. The doctor will diagnose not only the pathology of the disease, but the process, the road by which it occurred. Systems are checked for dysfunctions. We want to know what's wrong, as well as disease, in order to enable the body to return to its function the way it was designed to work. Do you all understand this? Makes sense to you? Okay. And very importantly, this is done non-invasively, ladies and gentlemen, and without chemicals. Non-invasive procedures to bring patients relief they have not been able to find elsewhere. So our approach is to ask two major questions. What is the mechanism? Why is this going wrong? What is happening? Okay, two major questions. Herein lies the doctor's ability and skill to understand, recognize, and interpret body responses in the form of neurological tests and observations. Not a pill, not a pill, okay? This is done to determine the precise type of procedure needed to restore proper pathway communication. Latest discoveries in functional neurology point to intricate interconnections of brain cells and their ultimate control of the human body. These discoveries have revealed the missing link in healthcare and led to new breakthroughs in contemporary neuroscience. It's a gift. It's a gift to humankind. We need to take advantage of it. The world needs to know, don't live in despair. There is no more darkness. Anybody's familiar with this picture? Anybody has seen it? No. What's that? This is one brain cell in your brain. One of them. And you know, guess how many there do you have of those? 100 billion. 100 billion, and they're all firing all day long, firing, trying to regulate you. 100 billion. Okay, majestic picture, majestic. That's exactly what it looks like. Okay, so if there is an electric imbalance in these, we're in big trouble. Would you agree? Yeah, yeah. Okay, what makes our approach unique? Very, very important. We conduct a comprehensive brain-based neurological examination, and some of you who've been with us know exactly what we're talking about, okay? Comprehensive brain-based neurological examination to identify the areas of the brain that are not functioning correctly, okay? Second, there is no one-size-fits-all diagnosis or treatments. You are not treated like you, everybody's different. Everybody has a different DNA, different function. Diagnoses and treatments are individualized. and most of you know that. We do not treat generalities, like, okay, just overall treatment. It's specific, targeted, okay? Our treatments are non-surgical, non-pharmaceutical, no drugs or surgery, okay? And most importantly, we take time to listen to you. We want to know what's going on in details, not 2 minutes and, okay, yeah, you're fine. Oh, you look good. No problem. Okay, we don't do that. Okay? The critical factor is in detecting and uncovering complex neurological layers and underlying mechanisms as they manifest in the patient, and not in focusing on generalities of the condition. That's not what it is. Okay? This is why I'm so passionate about what we do. Very, very passionate. I have dedicated my life to this science. The majority of our cases have been the most severe and chronic cases, and most of you know that, which have proven resistant to years of conventional treatments. Years. People come to me with, they've been seeing doctors for 25 years, 30, 17, something like that, okay? In case after case, I have observed patients respond dramatically to our non-invasive and non-pharmaceutical treatments. And ladies and gentlemen, thank you very much for listening. Open forum, questions and answers.